Good morning, Dr. VDN.
Good morning.
Could you start off with telling us who you are and what you do?
Yeah, so my students call me Dr. VDN because my name is super long. My name is Vondolee Delgado-Nixon, and I'm the Chief Diversity Officer at Ohio State, the Ohio State University College of Optometry. And I also have been faculty there for 20 years. So I teach the first year students all year long. I teach them pathophysiology, which is fondly referred to as all the ways you can die. And then I teach biochemistry for optometry and also microbiology. You get bugs growing on contact lenses and stuff like that. So awesome. Lots of fun stuff. And I'm sit on admissions also for the college.
What is a typical day like for you?
So, a typical day is for me varies. I think that's really why I love my job. Optometry allows me to have a really wonderful work-life balance. So as a woman, I love science. I have always been one of those very analytical types of people. So, and I also really love to learn. And in my particular day, throughout a day, I might spend several hours learning something new for my courses or something new in optometry, something new as far as teaching, something new as far as diversity. So I love learning and it allows me to do that. I also, on a given day, will spend quite a few hours with my students. So I love to interact with my students. I know them both as it relates to their coursework, but also as it relates to um, uh, the as it relates to the coursework, but also as it relates to them as people. So optometry is, as a field, what you should know about it is that it's very broad. So when you say a typical day, optometry, most people think, oh, an optometrist, right? They just do glasses and contacts, and that's it. And that is a big part of what the job is. But eyeballs are not detached from the rest of the body. They're not floating around. And so it is the only organ that you can look in and actually see blood vessels. So if you look in and you see signs of diabetes, an optometrist will actually see that before they actually start to have changes in their blood sugar. Likewise, if you have high blood pressure, an optometrist sees that in the blood vessels. In fact, optometrists can see actual blood cells flowing through a blood vessel. And so vascular disease that is occurring in the retina, that's occurring in the eye, is also occurring in the heart, the kidneys, everywhere else. And so the optometrist has a really important job. I mean, the job is that not only do people come to them for eyeglasses, but they're considered primary care physicians because, if you are maybe not taking really great care of yourself, maybe you're overweight, maybe you're a smoker, you might not want to go, or maybe you've had a bad experience as a diverse individual with a doctor, right? But if you start to go, right, so maybe you don't want to go see a regular doctor. But if you start to lose some vision, then you're going to go see your eye doctor and you're going to think, well, I just need new glasses. But what your eye doctor is going to be able to do is evaluate the health of your eye and the health of the rest of the body and determine whether or not you might not just need glasses, but maybe you have hypertension. Maybe you have the beginning of diabetes. So an optometrist does a lot more. I mean, we also will see brain tumors before because the pressure of a tumor inside the brain affects the eyes, the back of the eye. So when an optometrist looks in, they see that. We've also had, you might be surprised by this, but breast cancer, lung cancer, you'd think that the nerve that goes from your brain to your eye, it's right, the shortest distance is a straight line. In humans, we don't develop that way. The nerve that controls your eyelids and the pupil actually runs down your spinal cord over your chest wall and then back up. And so if you have a tumor in your breast, a metastatic tumor, or if you have a lung cancer tumor, it will compress that nerve, and that nerve will cause the eye to droop. So who are you going to go to? You're going to go to your eye doctor. I have my eyes drooping. Yeah. So red eyes also. Red eyes are another really good example. So, unfortunately, there's a lot of African Americans, for example, that are predisposed or are more likely to get diseases like lupus or rheumatoid arthritis. Guess what? They cause red eyes. So again, sometimes those are the first signs. They'll go to their eye doctor because their eye is red and they think, oh, I have bacterial conjunctivitis or viral conjunctivitis. I just need eye drops. Well, it turns out that they have an autoimmune disease, right? So when I say that I teach all the ways you can die, right, this is why an optometrist needs to know all of that. The optometrist then works with rheumatology or renal, your renal nephrologist, your renal specialists, the primary care providers, endocrinologists for blood sugar regulation. So it is not just eyeglasses and contact lenses, while that is very important. Optometry can save lives. And I always tell my students that we do. We put on our little capes too. So that is what optometry is. So I get to do that, right? We get to do that during my day. And then that work-life balance that I started talking about is really important for me. I get to pick up my kids. I have 2 boys and I get to take them, to school events, concerts. I've got a kiddo that plays hockey. So, we do I get to do a lot of stuff with my kids. In fact, one of my students joined a practice, and it was several women. There were 4 women in the group, and they converted one of the examination rooms into kind of a nursery and hired an au pair that would come in, or a nanny that would come in and take care of the babies during the day while they saw the patients in the office. A really good work-life balance for being able to still practice in healthcare, but also be able to be part of your family, which to me is really important.
Wow, that's interesting. I didn't know all that about optometry.
Yeah, it's amazing. I'll just say one other thing is that we also, if you're interested in sports and sports health, we also see a lot of, unfortunately, a lot of professional sports. So we have some NHL players that actually fly in to OSU College of Optometry due to concussions. Concussions are really weird. The eyes, right? We think about vision is sensed in the back of the brain, but eye movement, which we don't think about, is actually sensed really in different parts of the brain. And so you damage another part of the brain via concussion, your eyes don't move together. And instead of pairing, one maybe turns off or goes to the side. It might not be noticeable, but the brain's not making it work correctly. And so getting that person to retrain their eyes after a blow to the head is really important. Yeah.
Could you talk a little bit about the differences between optometry and ophthalmology?
Yeah. This is a great question. So optometrists do everything I just described. They treat glaucoma. They're looking at vision. They're looking at eye health. So like conjunctivitis, infections, red eyes, glaucoma, right? All that stuff optometrists can do. And then, of course, they're looking at the health of the entire person. An ophthalmologist goes to medical school and becomes residency trained, and they do surgeries. So, it would kind of be like if you get a cold, let's say you just get a cold, a respiratory cold, regular cold. I know this is time of COVID, but let's just say it's a regular respiratory cold and nothing severe. You're not going to go to a surgeon for your lungs, right? You're going to go to your regular doctor. So that's really the difference, right? So for your eyes, you should go to an optometrist. If you need surgery, let's say you have an eye turn, let's say there's certain diseases that affect the lids. Also, some that I haven't discussed, and the lid needs to come up more. There's some genetic diseases that do that. They'll need to surgically lift those lids. Or tumors, right? If there's some actually oncologists that are ophthalmologists. I always get a kick out of my students because they graduate, and then if they go to an ODMD practice, ODMD practices, ophthalmology practices, that's what I'm talking about, right? They're usually practicing together. They're usually retinal surgeons or lid surgeons or something like that. Oftentimes, if there's residents in the practice, medical residents, it's the optometry student that actually teaches them how to do the optometry exam, right? How to use the slit lamp, how to do dilations, et cetera, because they haven't learned that in medical school. Yeah.
Okay, thank you.
Yeah.
Could you talk about some of the some of the challenges that you went through being a woman, going through fields that are usually dominated by men?
Yeah. Wow. So when I started 20 years ago, it was predominantly white men. Right now, I will say, and that was a particular challenge because, there's misogyny in every single healthcare, right? Where the female, she's more interested in the idea is, or maybe the notion by some people might be, that a female doctor doesn't care as much about being a doctor as they care about their family, right? Which is not true. So I think being a woman can be difficult, but in optometry, I've witnessed a really interesting change in which right now, 2/3 of my classes, the incoming classes in optometry, are women. And I think that is largely due to the work-life balance. I'm also starting to see a lot more men that are interested in having families that want to have that work-life balance as well. It's not just women that want that, right? It's also men. So for female male, there's been a change. And in fact, our dean is a woman. So women in my college are really well supported. I would say it's almost not a factor. Okay. I mean, to a small degree. I think being Hispanic, I'm originally from New Mexico. I'm originally from Santa Fe, New Mexico. And being Hispanic, I would say it has been difficult. And there have been times where, people have come in from wherever they grew up and have never been exposed to anybody that is Black or brown, right? And so I have, in the past been challenged a little by white individuals, white students in particular, that aren't sure that whether I know what I'm talking about. But I would say that my belief is that I do my job to the best that I can, and I let that speak for itself. And so if I can do my job and show you that I know what I'm doing, then maybe the next time you see a Hispanic woman who's a doctor, you might not even have a question about it because you've already interacted with me and you know that I know what I'm doing. So I do things by being a good role model. And yes, I have to do the best I can. I do more than what I probably need to do, but that is the way I do things.
Thank you. I know you mentioned that optometry has a pretty good work-life balance. Could you talk about the journey to get there from undergrad to optometry school, like how many years that is, and things like that?
Yeah. So I can only speak for OSU, College of Optometry. There's not a lot of colleges of optometry nationally. It is a 4-year program. You have to go through all the the same thing you would probably do for pre-med. So, I would say for the most part, you need to look up for each individual institution what their prereqs are. But of course, it's going to include your chemistry, your biology, your physiology. There's physics because optics is physics, right? You have to have your regular calculus, OChem, and I didn't already mention that, physiology, microbiology, all that stuff. So you need to do that. There is a national application called Optomcast that you have to fill out and that all the colleges get. And there's usually a standardized test. And then an interview, right? So OSU is a little unique. We do something called holistic admissions. Holistic admissions means that we are not just looking for the 4.0 student that had the most amazing standardized test. Because I'm not going to be interested in taking somebody like that can't have a conversation with a patient, right? Can't interact, have empathy with a patient, versus somebody that can and maybe has a lower GPA. Maybe they're 3.5, 3.4, decent. I think, 320 OAT. OAT is the standardized test for optometry. I'll take that person that can have a conversation, that can be empathetic any day of the week. So for OSU, we take the OAT. We also take the GRE. We'll take the MCAT as well. Because we recognize we want to increase diversity, we recognize those standardized tests cost a lot of money. And if you're going to take the MCAT and you're going to do well, we'll take that. We'll take that MCAT if you've changed your mind. Our interview process, you should know that our admissions team has all had implicit bias training. We also all have a diverse representation on the admissions team as well. So you will not just see white faces. You'll have, in a way, an advocate. I serve as that individual, and Dr. Lai serves as the individual as well. So we have two teams. And then we also, something that's really cool is that we all look at something called a bias mitigation checklist before all interviews. And what it is it's a list of have you things that you need to think about as you interview the individual. Can you take their perspective based on like what it is they've gone through to get to this point, to this interview? Can you show empathy, right? Can you, if maybe you need to identify with somebody that's a good stereotype. So let's say it's a Black male. Well, then I'm going to think about all the Black males that I think are amazing. I'll think about Barack Obama, Colin Powell. I'll think about, most of mine are political, but these Black men that have done amazing things. And that's the mindset I'm going to go into when I interview you. So we go through a checklist and then we do a holistic open file review, which means we are looking at your file because maybe your GPA is 3.4. But by looking at your file, we notice that it started off lower and it's continuing to go up. And we can ask you questions. We just had an individual that interviewed recently and he went up in his GPA, but he was able to describe that he lost his mother in his freshman year. Right? If we didn't have the file and we didn't care about the GPA, right? Ask the question, it just went GPA only. It's not a 4.0. We're not taking you. Then we wouldn't realize what a great individual this person is and how much tenacity and resilience that this individual has. In addition, we also ask kind of an inclusive behavior question of all of our students. We want our Black and brown students to know that we value inclusion, not just numbers. It's not just about getting the numbers of diversity. It's about having inclusive behavior. So I want my Black and brown students that are coming in to know that OSU Optometry is committed to diversity and inclusion. We're going to ask that question of them, and we're going to ask it of every single white student as well. So it's a universal question because I want my white students who understand social justice and empathy, who are going to be good doctors to treat everybody fairly. So that's kind of a long-winded way of talking about at the admissions process at the College of Optometry.
What would be the best one piece of advice that you can give to any aspiring optometry students?
You know what? I think that you should keep an open mind and an open heart, and you should shadow. Go see your optometrist. You know, call your optometrist. If you're not sure about optometry med, go shadow those individuals. Ask yourself, who seems happy? Who's enjoying this job? Because you're going to do this job for the rest of your life. Go to open houses. I have, by the way, I run a summer camp for diverse students called iDoc. Go do those kinds of different opportunities. Involve yourself in that. Ask questions. I'm available. You can reach me by email, delgado-nixon.1. I guess I'm the only Delgado-Nixon at OSU, so .1@osu.edu. Reach out to me. I'd be happy to help you in any way I can.
Okay, thank you so much, Dr. Vidia, and we really appreciate your time.
You're absolutely welcome. Thank you.